Hey, good afternoon. So today I want to talk to you a little bit about tennis elbow. Happens right here, or does it? Let's find out. So tennis elbow is really common these days. All sorts of people get tennis elbow for a lot of different reasons. Why is that? That's weird. So before everybody had phones, when people play tennis, they work from a rotated position with a big range of motion. They're doing their backhand, their forehand, they're whipping their arm around a lot. There's a nerve that comes from your neck, like your C5, C6, so kind of towards the bottom of your neck, and it goes down your arm and around your elbow bone, and then down to your hand. So that nerve needs to be able to glide. It needs to be pretty lubricated so that you can do all those things. So it used to be people that played tennis, massive amounts of stress on the arm, gets a little wound up, gets tight, nerve isn't gliding, it's getting caught up right here. Inflammation. Inflammation. Nerves don't have a blood supply, so it's just going to get worse if it's not getting better. So then you get all sorts of burning, numbness, pain. It can be quite debilitating. And today, people are using their phone, they're twisting their arm up and holding their phone, so they're putting twisting tension here on their arm, and then we're looking down and stretching our neck. So we're putting so much tension on the nerves of our arm, and it's causing inflammation as it's running through those hard bony points, consistently under tension, sitting in one spot, frozen for a long time in that extended position, can create an issue. And the same thing can happen with a number of different positions, especially when your neck is really tight. So if your head is forward, no matter what you do with your arm, the nerve is already in an overextended position. If your shoulder's forward and your neck's forward, it's going to be a lot worse. A lot of people are so tight in their thoracic spine and their neck that they can't even extend their spine. And it's no wonder that those people are having tennis elbow-like symptoms. So today, we're going to do a couple different activities that you can use to prevent or manage tennis elbow. The first thing we're going to talk about, if you have tennis elbow already, it's really bad, one thing you can do that probably would help you a lot is wrapping your arm in a towel. Okay, so when you go to sleep, if you're sleeping especially on your side or on your front, and your shoulder is all twisted and extended and your elbow is bent, arm goes numb at night, that is probably a big source for stress on your nerve. And if you already have tennis elbow, it's going to be stress for your nerve. So you wouldn't really do this unless you already had tennis elbow, because it's kind of silly, but great way to help the nerve calm down. So basically, you wrap the arm, and you could use any big towel. You could use a blanket, rolled up sheet, whatever you got. And then I'm going to use a strap. But in the past, when I've had tennis elbow stuff, I would just tape a towel with duct tape. But I don't really want to tape up my towel today. And I have a bunch of straps because I give them to people all the time, so we're using a strap. So you get it around your arm, and you give it a good tighten. With whatever your implement is that you're using. Usually put a row above and below the elbow. And then I can't bend my arm as much. I can bend it a little, and depending on how good the wrap is, you'll be able to bend it a little or a lot. Don't cut off your circulation. And then, as long as you don't rip it off when you're sleeping, your elbow is going to be able to rest in that straight position so it can deal with a little bit of the inflammation. But nerves don't have a blood supply, so their ability to deal with inflammation is going to be reduced. So just keep that in mind. If your elbow is so inflamed that straightening it and then bending it in the morning is an issue too, decide what works for you. But bending it and sleeping is probably going to be more injurious than straightening it. So Try it out. Now I'm going to show you 5 activities you can do for your posture that will help tennis elbow and nerve tension in the neck. So we're going to start by lying on our back. We're going to have our hands out, palms up, and our knees and feet wide. So nerve tension can be kind of a global issue. Like one part of the body that can hold tension can put stress on the nervous system physically. That can cause stress in other areas. So if we're trying to address an acute area of the spine where one nerve is being pressed, we want to start by doing something to balance the whole body. Prepare it to make some change. And then zoom in on the issue as we continue. Now when you're rolling your knees, call this one lazy rolls, you want to really let your hips settle over to the side each time. You can spend a few seconds over there if it feels good. Coming back up, using a low amount of effort to move. That's going to encourage your hip flexors and your rotators to work with you, causing gentle rotation up the spine to the place between the shoulder blades, tugging on the neck ever so gently. And this will work for someone probably with severe tennis elbow or someone with more mild tennis elbow or just in tension and discomfort. And then we're going to lay our legs out flat. Great job. We're going to put our elbows beside us, about a 45-degree angle to the body, and you're going to press your elbows to the ground and feel your shoulder blades work their way under you a little bit. It might take a few times to get it going, but avoid letting the shoulders lift up off the ground or roll forward when you press, because if you're compensating, that can occur pretty easily. You should feel your chest lift as you press your elbows. Just try to observe anything else that's happening as you press your elbows and focus on pressing your elbows. I like to exhale as I press. Inhale as I do nothing. And it's important to exhale fully. And that's going to engage your diaphragm. It's going to help your ribs move around a little bit. And engaging your diaphragm really is never a bad thing. I think a big difference between a successful person and an unsuccessful person is probably breathing with the diaphragm. You just want to do it about 20 times. Pretty close, I got like 6 more. And we're just using leverage and kind of tricking the nervous system into creating a little retraction and engagement across the back that could be difficult with our conscious control if our posture isn't something that we manage a lot. If we're not practicing manipulating our shoulder blades, it can become very dysregulated. And as a tennis player or a person with tennis elbow, you probably have a big disparity or difference from one side to the other. Okay, that's good. Number 3 is going to be cats and cows. Lots of people know how to do cats and cows. It's actually just as great as everybody says. So you're going to put your hands and knees in a square position. I always tell people to start by rolling the hips and then allow the rest of the spine to follow that movement. And really focus on moving the head at the end of the movement, because your neck is a very important part of your spine and you want to incorporate it into whatever movement you're creating. And we'll just do about 10 or so. This is great because it's flexing and extending the spine without really adding a lot of pressure. Stuart McGill, one of the greatest spine scientists ever, has identified cats and cows as a very helpful position with an exceptionally low amount of pressure on the spine and the discs that can even help discs become repositioned among the vertebrae if they're coming out a little bit. Happens a lot more commonly than most people would like to think. Number 4 is going to be scap twists. We're going to stay in the all fours position. We're going to have our hands flat, fingers spread, knees square. We're going to draw our shoulder blades together and stick out our chest a little bit, and then roll our elbows all the way in and all the way out. And we really want to focus on keeping our shoulder blades seated together on our back, making kind of a supportive plate. There's 17 muscles on each shoulder blade, and as long as your elbows are straight and your shoulders are retracted, you should begin to use a great number of those muscles to cause rotation on the shoulder blade. Many times with tennis elbow, the nerves can get caught up in the armpit and or the neck as they travel down towards the elbow, where the inflammation-based damage is being caused. But the kind of tension that causes the nerve to become damaged can be created by another part of the system. Great job. Number 5 I call palm rest. You're going to get yourself lined up with the wall to the side. You want to have just the right amount of distance between yourself and the wall so that you can rest your hand there without pushing yourself away from the wall or leaning into it. You're going to have your fingers spread, and this is going to stretch the nerve as it exits your neck all the way through your shoulder, elbow down to your fingertips. So some pretty common places to feel intensity are going to be shoulder, bicep, forearm, thumb, fingers, palms. Wherever you're holding onto that tension, this position is going to force your body to kind of associate with it and figure it out, because it can't really hide. Your shoulder might hike up, might be uncomfortable, your body might twist out of position. You want to resist all those things and just leave your palm just here for 1 to 2 minutes until you feel some change, or until the change stops happening so much. If you're feeling like a pro and it's not that difficult, you can twist your elbow up and down. And that's going to add a little bit more nerve flossing to it. It's going to use your rotator cuffs, working your shoulder from a good position, increase blood flow, all that nice stuff. Another thing that I don't recommend that often, but it could be helpful for you if your shoulder's extremely rolled forward, you could put your palm on the wall sideways or upside down. But if your wrist hurts when you do that, not a good exercise for you. Just do it the regular way, or a way that's comfortable. But this is just going to drive rotation into the shoulder blade, so it's rotating back and down. So it's naturally going to cause the body to respond to the position by opening up the front of the shoulder and the top of the pec, which can be a very tight area, especially for tennis players and usually for people who have tennis elbow. And try to do both sides. That's all I have for you for tennis elbow. So you want to focus on reducing the inflammation, staying out of the painful positions, giving it time to rest before reintroducing those activities, and making sure your shoulders and neck are in a good position. If you want to know more about generally balancing your posture, check out other videos on my channel, blogs on my article, subscribe to my newsletter on my website, like, subscribe, share it with your mom, anybody with elbows, this one. Thanks for watching. Have a great day.